Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with special concerns of women, starting with the letter U. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and metabolism, and then infections, infestations in the immune system, then issues surrounding fertility and pregnancy and surrounding childbirth and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with special concerns for women, starting with the letter U. Between puberty and menopause, a span of approximately 35 years, a woman ovulates about 400 times, normally at intervals of 28 days. If an egg is fertilized, pregnancy follows. If not, menstruation occurs as the vascular lining of the womb is shed. This cycle of fertility is maintained by 3 hormone-producing glands, the hypothalamus, pituitary, and ovaries. The ovaries produce 2 hormones, estrogen and progesterone, in response to 2 hormones produced by the pituitary, which are follicle-stimulating hormone, FSH for short, and luteinizing hormone, LH for short. Estrogen levels respond to FSH levels rise dramatically in the 12 days leading up to ovulation, and are at their lowest during menstruation. Levels of progesterone secreted in response to LH are highest after ovulation, preparing the lining of the uterus, the endometrium, for implantation of the egg. Menstrual bleeding begins approximately 2 days after estrogen and progesterone secretions reach their lowest level. About 1.5 ounces of blood are then lost over 3 to 7 days. The uterus or womb is a thick-walled, pear-shaped organ about 3 inches long, with a narrow neck or cervix at its lower end. The mouth of the cervix juts into the top of the vagina. Opening into the bulbous upper end of the uterus are 2 tubes about 4 inches long called the fallopian tubes. The fallopian tubes are lined with tiny waving hairs that transport eggs from the ovaries to the uterus. It is in one or the other fallopian tube that fertilization usually occurs. There is no direct connection between the ovaries and the fallopian tubes. Eggs are simply released into the fluid-filled perineal cavity and wafted towards the fringed entrance to the fallopian tubes. The ovaries themselves are almond-shaped and about 1.5 inches long. At birth, they contain many millions of immature eggs and follicles, but as already mentioned, only about 400 of them ever reach maturity. Although several eggs may begin to mature each month under the influence of FSH, however, usually only one egg totally matures. Once it has been released from its follicle, the follicle turns into a corpus luteum, literally yellow body, and proceeds to secrete large amounts of progesterone. The external female genitals, referred to as the vulva, consist of the fleshy inner and outer labia or lips that conceal the entrance to the vagina, and the clitoris, which lies just above the urethral opening where the inner labia meet. The clitoris is very sensitive and the focus for many of the sensations that trigger orgasm. The vagina is about 4 inches long, and it expands and lubricates during sexual arousal and is most sensitive near its entrance. It is protected from infection by populations of acid-producing bacteria. Breast development is one of the first signs of puberty in women. The breasts move with the pectoral muscles underneath, and their hang is greatly influenced by posture and the tone of the muscles that brace the shoulders back. Embedded in the fatty tissues of each breast are 15 to 20 clusters of milk-producing glands whose ducts converge on the nipple. The pigmented area around the nipple, called the areola, contains glands that keep the nipple supple. Uterus problems. Endometriosis is a condition in which fragments of the lining of the uterus migrate into the fallopian tubes, ovaries, vagina, and even into the intestines, where, still under the influence of estrogen and progesterone, they engorge with blood every month, irritating and scarring the surrounding tissue. This condition is most common in childless women between the ages of 30 and 40, but the cause is not known. Although selenium deficiency and use of tampons have been suggested. The symptoms include heavy periods, dragging period pains that tend to get worse towards the end of the period, difficulty getting pregnant, and perhaps painful intercourse are also possible. But severe cases are uncommon. In such cases, doctors may prescribe combined contraceptive pill or a drug that inhibits ovulation and gives the body time to reabsorb dispersed fragments of the endometrium. Fragments can also be removed surgically. Hysterectomy may be advised if the ovaries are scarred and no more children are wanted. Constitutional homeopathic treatment is recommended. In the meantime, see menstrual problems and painful intercourse for suitable short-term remedies. Fibroids. Fibroids are non-cancerous growths in or on the walls of the uterus, sometimes on a stalk and varying in size from a pea to a large plum. They tend to occur severally rather than singly and may take a few or many years to develop. Small fibroids are often symptomless, but large ones can give rise to heavy, prolonged periods, painful intercourse, and cystitis. They may also prevent conception. They can cause miscarriage or pain during pregnancy or obstruct delivery. If the stalk of the fibroid becomes twisted, cutting off the blood supply, the result is severe pain in the lower abdomen. The appropriate action is to see a doctor within 2 hours and take aconite 30C every 15 minutes for up to 10 doses. Fibroids are especially common in women aged 35 to 40, but the cause is not known, although it has been speculated that estrogens in oral contraceptives may encourage this condition. Small fibroids seldom require treatment and tend to disappear after age 45. Troublesome fibroids can be removed surgically through a D&C, which is a scraping of the uterus to confirm the diagnosis. Sometimes a hysterectomy is advised. Homeopathic treatment is constitutional, although in the short term the remedies that followed should be tried. Specific remedies to be taken 4 times daily for up to 3 weeks. Small fibroids, profuse yellow discharge from the vagina. Use Calcarea iod 6C. Swollen uterus, urge to bear down, brown watery discharge from vagina. Painful cramps during periods. Use Fraxinus 6C. Menstrual flow heavier than usual. Body feels icy cold, bleeding between periods. Use Pulsatilla 6C. Continuous bleeding. Use Thlaspi 6C. That's Thlaspi 6C. Short, scanty periods as menopause approaches. Great pain eased by the menstrual flow. The abdomen very sensitive to tight clothing. Use Lachesis 6C. Where menstrual blood is bright red, use Phosphorus 6C. Uterus feels as if it is being squeezed during periods. Use Kali iod 6C. Uterus feels swollen and painful. Spasmodic contractions of vagina. Use Aurum 6C. Prolapse of the uterus or vagina occurs when ligaments and muscles that hold the uterus and vagina in place become weak or slack with age or as a result of childbirth, allowing the uterus to bulge into the vagina and press on the bladder or rectum. This causes a heavy, uncomfortable feeling in the lower abdomen, generally backache, stress, incontinence, or difficulty emptying the bladder, or straining and discomfort when passing stools. If prolapse is complete, a large part of the vagina or uterus might actually protrude through the vaginal opening, causing soreness or ulceration and encourages infection. Surgery or tightened pelvic floor may be necessary if exercises do not restore muscle tone. A ring pessary fitted behind the pubic bone may be advised if the person is elderly. If the symptoms are not too severe, the homeopathic remedies that follow may be of benefit. If there is no improvement within a week or two, see your doctor. Specific remedies to be taken 4 times daily for up to 14 days. A dragging sensation in the lower abdomen made worse by doing jobs that involve bending or lifting, scanty periods, pain during intercourse, depression. Use Sepia 6C. Vagina very hot and dry. Pain in lower back, leaden feeling in abdomen and just below ribs, as if abdomen and pelvic contents are about to drop out. Use Belladonna 6C. Sharp spasms of pain, constant urge to pass urine or stool, irritability. Use Nux 6C. Sensation of downward pressure in the lower abdomen, pain in the small of the back, nausea, weepiness, heat, and periods make symptoms worse. Use Pulsatilla 6C. Nervousness, irritability, pain and tenderness in the lower abdomen, bladder affected, urgent desire to pass stool, itchy vulva that feels as if it needs external support. Rest alleviates the symptoms. Use Lilium 6C. That's Lilium 6C. Self-help. To strengthen muscles of the pelvic floor, try stopping and starting the flow of urine several times each time you urinate. This may be difficult at first, but persevere. These exercises are a vital part of orthodox and homeopathic treatment, and particularly important after childbirth. If you are heavier than you should, try to lose weight. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.